Good evening, everyone. It is my pleasure to welcome you all today to Hope in the Aftermath, a workshop on psychological first aid organized by the Core Group for Disaster Relief, the Faculty of Medicine, University of Colombo. On behalf of the organizing team, I'd like to thank everyone for joining us here today. A disaster can broadly be defined as any event, natural or man-made, that significantly disrupts the functioning of a community, making them unable to cope with their own resources. While we while we often tend to focus on the physical effects of disaster, providing relief, relocation, etc., the psychological effects of disasters are just as profound, and this is where psychological first aid, or PFA, becomes essential as a part of effect to provide immediate emotional and psychological support to those affected to reduce the distress and promote a sense of safety and support them in the early stages of recovery. It's a powerful tool that can completely change. Professor in psychiatry and the current head of department uh, of psychiatry at the Faculty of Medicine. She's a practicing consultant at the NHSL with over a decade of experience. She has special interests in youth mental health and has been an advocate for PFA. I'd now like to invite Prof. Chaturi to give us an introduction to the concept of psychological first aid.
Isn't the desktop? I put it to the desktop. Right. Thank you very much for this opportunity. And like for most people, psychological first aid, they don't know what it really means, if I'm to put it directly. Do you know what first aid is? Just leave apart the psychological aspect of it. I mean, like, if there is a sprain or something like that, what you really do first is the first aid, right? So just like that, psychological first aid is something that you do to prevent psychological injury. And more often than not, you'd see that the people are concentrating more on the cuts and the fractures and things like that, and they are so worried, like, not to get the spinal injury, so they would be like log rolling and all that. But the most impact is on the mind, and nobody seems to care about it, right? So it's very, very important that from this age onwards, that you are very sensitized to the psychological first aid, because it doesn't have to be a earth slip or a flood or whatever for you to be psychologically drained, right? Now, if you see for the first time, most often the guys, when you see the labors, you must have seen like lokko wage තාත්තා ටික තාත්තා ගියාට, like, to watch this thing, they say that අම්මට ඉස්සෙල්ලා තාත්තා කලන්තේ දාලා වැටුණා කියලා. So things like that can happen, and when you see blood in the theater, that might be a traumatic event. And also, like, depending on your personalities and your previous exposures, the psychological trauma is going to be different. Like, if I make a joke at one of you guys, someone might take it very nicely and take it as a joke, but for somebody else who is a perfectionist and who really minds about what other people think of them, that might be really traumatizing. Now, we see some local tuition class as well, like, the teacher cracks a joke targeting someone and they get traumatized forever, right? So it doesn't have to be an earth slip or anything like that, but it could be something trivial on our eyes, but something major to that person that might cause psychological trauma. Now, for example, after Easter Sunday attacks, now after the Earth's this time the floods, the Colombo was not that affected, so we didn't have much to do. But then during the Easter Sunday attacks, it was huge. And then we went to, like, the chief GMO office here. So we went there to, like, give psychological first aid to the relatives of the people. And our ones were, like, fainting by seeing the bodies. Right? And I hope you guys will keep whatever the information I'm sharing confidential and not take it out, but use it as study materials, because I might be, like, slipping away things that I have seen. So just keep it yourselves only, okay? Because I'm taking this as an academic forum, so that's why so some of them fainted. Like some time ago, after the Easter Sunday attacks at the CJMO's office, when we went there, just right in front of that building, there was a hut put up. And then on that hut was a slideshow. Can you guess what the slideshow was? That was like, welcome you all කියන්න වගේ තියෙන slideshow එකක්. And we went to give psychological first aid, okay? Any good guesses? People who have good imagination? I thought this was supposed to be a discussion. Well, like, after the Easter Sunday attacks, let's say a particular church, so whatever the body parts that were nearby, they were brought to the CJMO's office, and whatever the parts they recognized as belonging to one person were numbered, and they were put on a slideshow. So whoever the relatives will come, stand there, and then try to recognize that slide number 1, 2, or 3, or 4 belong to our relative. I mean, it doesn't have to be a relative of a injured person. Whoever who comes, like, welcome to CJMO's office, that's what you see. So there is not only one trauma, there is 2, 3, 4 traumas happening there. I mean, at that time, nobody was prepared. So there was nothing else to do. Like, you have to clear out the bodies, and there was a huge container parked outside. So that was how it was. So that was the best they could do. But although you could say that it was effective, because otherwise, the relatives will have to go inside the mortuary, inside the thing, and then open up the bodies and then peek into it. So before that, if they could recognize using some piece of clothing or whatever that is there in the photograph, that prevented a lot of psychological injury. Because අපේ සමහරු කලන්තේ දැම්ම after seeing the traumatized bodies, like, so that was the second step. So you recognize whatever that is, and then if you say it's slide number 3 or whatever, then you're taken to the third pack, right? So that's how it was. So just imagine, apart from the trauma that these relatives experienced, here we are talking about dead bodies, okay? It's JMO officer. The trauma they might be experiencing too when they see this whole slideshow. And the next trauma when they see their loved ones in flesh and blood bleeding parts, because they have to go and recognize them. So yes, the administrative part was happening, but not only the grief of losing that one, but they get re-traumatized. So that's why psychological first aid is there, to minimize that if we can. But during the first day, now in Easter Sunday attacks, the first day was like it was so hectic at NHSL, because all the bodies were coming from the churches, the hotels, and everywhere. Can we go and do psychological first aid the first day? where they are trying to recognize the relatives and the surgeons are trying to stop bleeding. So there is a place and a time for everything. Just because we are psychiatrists and because we want to do psychological first aid, එතෙන්ට ගිහිලා බාජින් කරන්න බෑ, surgeons ලගෙන් හොඳ වෙන දෙකක් අහගන්න පුළුවන්. Because the first thing is to preserve the life. Whatever the psychological trauma that is not going to take away the life immediately. And anyway, there is a sort of a sequence of things that will happen. So in the first few days, people are not going to commit suicide because they are dazed, they are stunned, they are looking for their loved ones, and they are like looking for shelter. They don't know, what happened to their house and so on. So there are more things to do rather than trying to find a place to hang themselves. Right? So you have to be mindful about these things. Now, everybody wants to play their part. So the surgeon wants to do the surgery and the psychiatrist want to do PFA, but there is a triad system. First, you need to release all the pneumothoraces and everything, then only we can go in. Because some of the patients can't even talk. And without knowing what's going on in their head, we can't do anything. And not everybody is going to be hurt the same way. Some people will be fine. Now, the whole world is worrying about the war, but Trump doesn't seem to care, right? So the tolerance level, the distress, and the where you look at the world is going to be completely different, right? And also, when delivering PFA, you need to think of what the place is. Now, after Easter Sunday attacks, in the initial times, where was the PFA indicated? Where would you be giving PFA? In the hospitals, right? Not in the during the, I was talking about the timing, but I'm talking about the placing. So it would be in the hospital. So once the patients are slowly getting stabilized, then you need to start it. And also that's a good place for you to sort of pick up other people, like the relatives, because if there is an index case, it's likely that the rest of the family is also there at the church when it happened. So you could slowly gather other information about those people who might be affected more. Right? So that's something that you need to think of, the place. But in the case of the floods, where is your place? The relief camps or the school that the people are, or a temple. So it's going to be different. And also the way we are going to deliver our services is going to be different as well. Now, if you are doing it at a hospital, it's easier, right? Because the patients have a bed and and then at least there would be one room to do the interview. But then at the camp, it's going to be tough. So you have to think of at least a confidential space and so on, because Sri Lankans being Sri Lankan and they are coming from the South Asian countries, they have the stigma, they don't want to open up. All these factors are also there. And if it is inside a crowd, they're definitely not going to open up. So that's why place is going to be very, very important, because people are not going to open up. And also, who to target. So timing, the place, and who to target is also going to be important. A patient who is on a ventilator, no matter how much the distress is, no point. Right? The patient needs to be targeted. The patient needs to be entered in a registry or something like that. But you have to wait until the patient is extubated. We get referrals. This patient in the ICU who is ventilated and GCS3 was exposed to the Easter Sunday attacks. Please do the needful. What are we going to do? So as doctors also, you have to use this beyond what you know about medicine. අර ටියුබ් එක තියාගෙන මොනවා කරන්නද? Right? So there is a timing not only to start everything with the specific patients also, there is going to be a different how to do it. Because at the JMO office, some people were like, no, we don't want to talk. So PFA is not something that is given by force. They need to be wanting it. They have the absolute right to refuse. Sometimes when they see us talking to the others and others come out slightly okayish, then they might come and tell you, I'm sorry, doctor, I didn't want to earlier talk to us, but I'm willing to talk now. Or can I give you my number so that I can talk to you after I'm better? Right? So then if you're into PFA, if somebody gives you the phone number and ask you to contact, you should be able to do that, because that person's preparedness is very, very important. Now, so this is in the aftermath of a disaster, but then now, like, I'm just saying, you all must be knowing like about what happened in the Lotus Tower and the Alta Towers. I am only seeing 3 faces doing this. අනිත් අය දන්නේ නැද්ද කියන්නේ? What happened at the Lotus Tower and the Alta Towers? So, although it's mega news for the journalists and the people who share posts on Facebook and the gossip sites, just imagine the staff at Lotus Tower who heard the whole floor vibrating when that girl fell down from the top. None of us could sleep after doing the psychological autopsy that day in the night because we saw the CCTV footage. දැන් දාරයට පෙන්නන්නේ මොකද උනේ කියලා. So, when we were doing the psychological autopsy, we had to go to the top of the Lotus Tower, and then, we saw the footage. You see actually what's happening, which I don't want to traumatize with. But then, so that's a time where PFA is needed, right? So it doesn't have to be mass situation and something like that. PFA needed if somebody commits suicide in our ward. Let's say a doctor, which we had to do last year, right? So, yeah. So, do you all know when to do, what to do at least now, like who to target? Because I have seen people jumping into doing their thing because that's what they do and what they know, that's the best way they think that they can help. That's not going to work, right? You have to have patience. So there is a psychological arm of a disaster plan, right? And we need to be a part of this disaster plan because, in small incidents, yes, you could carry out things like within the faculty or within a ward or at the Lotus Tower, yes, and at Colombo International, we had to do certain things. But when it's large scale, like tsunami or floods, then it has to be part of a national plan, and we need to be aware of limitations and what we need to do, because otherwise things are going to get out of hand. Because yes, Sri Lanka is a very hospitable country and people want to help their best. ඉතින් ගිහිල්ලා උන් ඉතින් කතා කරනවා. ඉතින් අපිට කරන්න පුළුවන් ලොකුම දේ ගොඩක් කට්ටියට කතා කරන එකනේ. And PFA, mind you, is not for medical people only. Anybody can be trained of it. හිතන්න ගමේ ඉන්න අර කවුරු හරි මැදිවියේ කාන්තාවක් ඕකට ඒගොල්ලෝ ගිහිල්ලා කරන්න. ඉතින් මොකද උනේ ඊට පස්සේ? අනේ ඇත්තද? එතකොට අරයා මොකද කරේ? So that's what's going to happen. And ඒක කතා කළා එයාගේ හිත පිනවගෙන about all the story, they go away. And this person, after that emotional arousal and bringing back all the trauma memory, is left just unattended. So that's why one of critical incident debriefing is contraindicated after disaster. But our people, being our people, without knowing that this is almost critical incident debriefing, they go and have a chat. So you don't dig their story. If they want to ventilate, yes, let them ventilate, but don't try to try gather information from them. Because then all of us are not professionals in handling trauma, so you are going to leave this person ගෙදර එකයි යන්නේ ඊට පස්සේ flashback එකක්වත් ආව thing in the night when you're not there. Nobody's there to sort of take care of the patient. So the fundamentals, the objectives of PFA is to eliminate or reduce the risk of suffering psychosocial injury, and then to distress among the population, and to contribute to prevention and control of the range of social problems arising in the population, and to prevent, treat, rehabilitate mental disorders like post-traumatic stress disorder, alcohol dependence. These things can happen, but these things are not going to happen right away. For you to diagnose depression also, it needs to be at least 2 weeks. And to provide support and psychosocial care for the members of the response team. So when we did the Easter Sunday attack psychosocial response, every day we had to talk to our team members because they would come home with some traumatic stories. And it is not, now you might think that it is the blast එක දැකපු එක, things like that. But for the, let's say in the team there was a mother කියලා who is also a support care worker. එක අම්මා කෙනෙක් අපිට අපි ගිහිල්ලා දැන් ඉතින් second stage of Easter Sunday attacks was once the patients were discharged to the community, so we had to go to the community. And then ඉතින් අම්මා කෙනෙක් දැන් අම්මගේ පුතා නැති වුණා කිව්වහම we are expecting like a lot of trauma නේ. ඉතින් we also went. අම්මා ඉතින් දැන් කොහොමද? නෑ මට එහෙම ප්‍රශ්නයක් නෑ. අපිට ලක්ෂ දෙකක් හම්බුණානේ. අපි දැන් මේ තව බබෙක් හදන්න හිතනවා. And then that was shocking for us. You see, so it might be anticipated shock, like about the blast and everything, where one moment ago the little kid was there and the next moment the kid was like in ashes like. But it could be trauma like this. Now for me, that what the mother said was like reverberating in me. How could you like ලක්ෂ දෙකකට අවුරුදු 17ක ළමෙක් මේවා කරන්න කියලා? So you have to expect the unexpected. So that's very important. And one of our SRs fainted at the CGMO's office. So then you have to, that's why after the end of the day, the debriefing for us is very important. Now, when the doctor in our unit committed suicide, it was 2 members of our department who first found her. She was not there for the ward round, so we had to go. And then I went, and all of us were traumatized. So PFA can be called for at any moment. It doesn't have to be a flood or an earth slip or whatever. And ensure psychological recovery, which is very, very important. Because how do you help these people to recover? Recovery model in psychiatry is we try to bring them back to their pre-morbid state as much as possible. How can we do that? So this is a little bit too much for you, Maker. So the impact, physical aspect, we don't have to worry about it. Then the emotional, then the social, social impact comes out of physical impact also, like atak kakulak nattang etanat social impact එකක් තියෙනවා. And also the social impact comes because I have lost my financial ability, and then I might have been a beautiful wife and now I have a huge burn around my then like my image. So it's beyond the physical injury, and most people would not target about the emotional injuries in that respect. uh, so it could be because of the floods per se, it could be the first responders who are seeing people මෙහෙම අත දෙන්න යනකොට මෙහෙම ගහගෙන යනවා, so things like that, right? So all of these factors should be kept in mind. So why we give PFA is because we want to stop the long-term sequelae as much as possible. Because acute effects are most of the time only going to have short-term effects. Like let's say if it's an acute stress reaction, they would cry, roll around, සුමානයක් දෙකක් යනකොට they would be fine. That's why most of the disorders are defined by a duration where it lasts for more than 2 weeks, 1 month, and so on. So acute stress reaction, which is like most of the time time limited, it's just like self-limited, it's there. But then if we can't prevent the acute stress response, and if we have not handled the acute stress response, if it lasts for more than 4 weeks, then it becomes post-traumatic stress disorder. Right? So that's what we mean by acute, most of the time short-term effects. But if we can't do anything about it, it will end up in long-term sequelae. So, and PFA is not only about recovery, response effects, what is happening to us, and also community preparedness. What we usually do is like මේ සැරේ ෆ්ලඩ් එක ආවා, අපි දන්නවා ඔය කන්දම ආයි නාය යනවා කියලා. හැබැයි ඒක යටම ගිහිලා ආයි ගයක් ගහනවා. Right? And also අපි දන්නවා සුනාමියේදී මුහුද අර පැත්තට ගියාම මිනිස්සු මාළු බාණ්ඩ ගියා කියලා. Right? Do you all know that? මුහුද පිටිපස්සට ගියාම people දැන් මේ සැරේ කොහොමද ඒ වගේ මිනිස්සු මැරුණේ? ගම් වතුර බලන්න ගිහිල්ලා, right? So that's because community preparedness is not there properly. සහ කියන දෙයක් අහන්නේ. And do you know, දැන් ජීවිතේට ආසාවෙ හින්දා තමයි ගෙවල් හදාගන්නේ. ඊට පස්සේ ගේ ආරක්ෂාව කරගන්න කියලා පළවෙනි තට්ටුවට එනකොට දෙවෙනි තට්ටුවට නගිනවා, දෙවෙනි තට්ටුවට එනකොට තුන්වෙනි තට්ටුවට නගිනවා. ඊට පස්සේ ගේ ආරක්ෂා වෙලත් නැහැ, තමන් ආරක්ෂා වෙලත් නැහැ. And the choppers can't come to these top places. So it's very difficult to rescue when they're isolated in these buildings. That happens. අන්තිමටම ජීවිතේ ආදරේ හින්දා ගේ හැදුවා, ගේ ආදරේ හින්දා ජීවිතේ නැති වුණා. So community preparedness is also about, they said, educational certificates අනම්මනන් ටික අරගෙන යන්න කියලා. That is also part of psychological first aid, because you are being taken to a safe place. So in community preparedness, we have to again and again remind our people about that. Now, I know, luckily you guys were not. When were you all born? 2000? Right, so also you all were exposed to the war, right? I mean, ගිය සුමානේ බෝම්බයක් පිපිරෙනවා. අපේ කට්ටියට තව සුමාන 3ක් යනකොට මතක නෑ ඒක. So the community preparedness is not there at all. මෙතන මොකක් හරි කේප් පෙට්ටියක් තිබ්බොත් ඒක ගාව ගිහලා වාඩිත් වෙයි. So that's community preparedness. So like, we need to strengthen as part of PFA about people's awareness. alertness, like, if there are notices being given to evacuate, please evacuate. And it's very important that you need to specially focus mentally ill children, elderly, women, and the poor, because they are at disadvantage, right? And also everybody you'll be hearing this quite a lot. Everybody should be knowing their limits. So, in a pyramid, advocacy for good humanitarian practice, basic services, all those things are at the bottom, because that should be given to everybody. And then activating social networks, supportive child-friendly spaces, that is community and family support. And PFA, basic emotional and practical support for selected individuals who would want to do it, who want it, and who are likely to develop psychological sequelae. That means focused but non-specialized. That is where the PFA come in. And then focus specialized, that is like PTSD. So like, then they have suicidal ideas, alcohol dependence, and all that things. So here, this is where we give PFA. So like, let's say රාගම පැත්තේ නම් තියෙන්නේ ෆ්ලඩ් එක, මේ රාජගිරි ඉන්න පැත්තට ගිහිල්ලා ඒගොල්ලන්ව චුට්ටක් මේවා කරන එක තමයි basic services and security කියලා කියන්නේ. Right? තව at risk people ලව එහෙම අයින් කරන එක තමයි this. Here they are affected. So emotional practical support එක දෙන එක. But if they have a disorder, they should be referred. So you need to first prepare. Learn about the crisis event. අපි යන්න ඕන කියලා කට්ටිය දෙතුන් දෙනෙක් එකතු කරගෙන ගිහිලා අර කොටන් කෑල්ලක නැගලා you don't go and help people. Right? So that's why I told you that you have to be aligned with the national plan. So divisional secretariat එකක් හරි ග්‍රාම සේවක කෙනෙක් හරි faculty එකේ මොකක් හරි තියෙනවා නම් ඒ වගේ center point එකක් එක්ක you have to collaborate all the time. Otherwise ඕගොල්ලන් හොයන්න තව කට්ටියක් එවන්න වෙනවා. Right? So you have to learn about the crisis event. Now that day at National Hospital, we didn't know where the bomb has gone. So basically we were first identifying from the hotel, they were wearing badges there. So එකෙන් එනකොට we knew okay Hilton was affected. Then Shangri-La වලින් එන්න ගත්තාම we know Shangri-La affected කියලා. So that's how it started. And first when the patients came, they were like very dressed nicely and so on, because it was the mass for them. And then you couldn't figure out whether it's at a church or a wedding. So it was that bad. So learn about the crisis event, learn about the available services and supports. If it is a huge flood, you need to know whether there are boat services available and whether Navy is there. Because your safety is the first. Because safety and the security concerns are very, very important. Are there any electricity wires going on? Because it's water. Is there a risk of further earth slips? So those are very important. So prepare, then look for your safety. Observe for people with obvious urgent basic needs. This is, we are talking about water, food, or if somebody is like really behaving really badly, like, perli perli andana wagena, there's something seriously wrong, because there are 100 people and only one person is behaving like that. Randu karanwana, you might more to know what is happening there. Then observe the people with serious distress reactions. So those are the people that you need to look for. Observe for safety, observe for people with obvious urgent basic needs. Basic needs can emotional strength එක නෙමෙයි, emotional support එක නෙමෙයි, right? ඒගොල්ලන්ට ඇඳුම් තියනවාද, බොණ්ඩ වතුර තියනවාද? That is what it is. Then you need to listen. Make contact with people who may need support. Now during the Easter Sunday attacks, there were kids at LRH, anit kid at the Colombo South, amma at NHSL, another mother at Colombo North, father at Colombo North. So we had to gather information, and because there was no coordinating system, අපේ psychiatric social workers තමයි අර හෙට මෙහෙට call කර කර බැලුවේ අතන අම්මා ඉන්නවද මෙතන තාත්තා ඉන්නවද. It was that bad, right? So make contact with people and then ask about people's needs and concern. If you ask the patient, they might tell you, like, I need to get down a relative of mine. That person is in the UK. Please contact that person. My phone is dead. I can't remember. So those are the psychological first aid that we are talking about. Nothing else. Then listen to people. Help them feel calm. You listen only. No information digging. Right? Because otherwise you will be leaving. You're not going to stay at that camp that day. Right? And then if you do come across people who have suicidal ideas and all that, then you need to refer. Psychological first aid is not about managing suicidal risk, homicidal risk. මේක ඔක්කොම උනේ මේ ආණ්ඩුව හින්දා තමයි කියලා ආණ්ඩුව කට්ටියට වෙඩි තියන්න යන කට්ටිය ඒව නෙමෙයි. So එහෙම එකක් තියෙනවා නම් you need to refer for specialized services, right? And help them feel calm. නෑගේ අපිට හෙට බලා ගන්න පුළුවන් එක යට වෙලාද නැද්ද කියලා අද ඔයගලන්ගේ ජීවිතේ බේරලායි තියෙන්නේ. So you have to be very mindful about their mindset, but at the same time you need to be able to tweak in the fact that ඕගලන්ගේ ජීවිතේ බේරිච්ච එක ලොකු දෙයක් rather than ගේට වඩා කියන එක. And then link. So help people address basic needs, access services. That's why you bring them to secure places. Help people cope with problems. So that's why I mentioned about the phone chargers and things like that. Okay? But that doesn't mean you're going to take a risk and get them to get the oppo of the house from going to the house. Okay? So you need to be very careful in what you're going to help with. Give information. ඒ පැත්තට යන්න බෑ දැනට හැටියට. And අපිට contact කරගන්න විදිහක් නැහැ because all the phone lines are dead. You can't lie to them either. But you can postpone information. If you for sure know that the kid has died or something like that, චුට්ටක් ඒක වෙලා වෙනකන් ඉන්න වෙනවා because ලොකු crowd එකක් මැද you can't break bad news. Right? So that's going to be disaster there, another disaster. Connect people with loved ones and social support. So PFA action principles are prepare, look, listen, and link. Nothing more. So that's why I said that it's very, very important that we need to have the coordination, human resources, knowing our limits, training, education, dissemination of information, which you guys who are doing PFA is not able to do because they need to be provided to you. What you're going to do is these. That's why PFA is first aid. Like if there is a fracture, you need to know that, you should like anchor it to something and take to the hospital. That's it. For the moment, you stabilize them, telling them we don't know the information, but keep calm. The first thing is you're safe, so let's take it from there. And you need to say we'll be back tomorrow, or another team will be back, and I'll be handing over your information to this person, so they can take it from there. Because arbitrary vague ඒවා කියන්න යන්න එපා. Because the uncertainty is killing them, and you can't be uncertain as well. So just know where you guys are. So when it comes to psychological first aid, usually it's with the psychiatrist and the mental health team. But above that, there is a district psychiatrist and the Sri Lanka College of Psychiatrists, Disaster Management Center, and so on. And there should be a coordinator. Even among you guys, there is one coordinator, and for each groups, there should be sub-coordinators, because people are going to get very tired. And also, just because one person is tired and fell sick, we can't stop the program from going on. So don't let the thing that, I know all the facts and I'm the one who is handling mata malaria හැදුනත් therefore I have to go to work. ඒක වෙන්නත් බෑ. ඒ වගේම අයියෝ අරයා නෑ ඒකින්ද දැන් අපි මෙතන ඉඳන් මොකද්ද කරන්න කියලා අනිත් කට්ටිය උඩ පයින් level එකක් වෙන්නත් බෑ. So there should be coordinators, and then there should be a plan, and everybody should be aware of that. If this person is not there, the other person should know what is happening and what to do and how to take it from there. Because in Sri Lanka, එක මනුස්සයෙක් දෙන්නෙක් නේ කරන්නේ. අනිත් කට්ටිය are followers. That can't be in this. If I get a heart attack, there should be somebody who to take it up, pick it up and go. So when you're doing all this, that is also very, very important. Assign tasks. This is the team who is going to pick up the people with abnormal reactions. This is the team who is going to just go talk and find out, even within the people who appear to be normal, there are abnormal reactions. Right? So you can divide it. These are just examples. Some people might be good at talking. They can go and talk. Some people might be good at coordinating. They can coordinate. Because all these factors are there and it's needed. So when there is a team for the PFA, identifying the extent of the disaster. Is it within your scope? දැන් මුළු ලංකාවේම වෙච්ච එකක් ඕගොල්ලෝ විතරක් ෆැකල්ටි එකේ කට්ටිය විතරක් කරනවද, or are we going to get down Jaffna faculty, Calania faculty and have a mass meeting and sort of distribute work? So identifying the settings, areas of disaster, your limitations. First you need to get your requirements. Don't gala vasekka nagala andepa. That's what happened during tsunami. There was nothing PFAs, mokakkat naha. I was a final year student. And then we got into a bus and we went and we didn't even know where to go. Ara kaluwa marupangiya wage thamai etakota. So that can't happen, because that was the first time that Sri Lanka had a disaster of that kind. Nobody knew what to do And then we were waiting in front of Karapitiya faculty, and there were dead bodies traveling in lorries. And that was the exposure. So just because යන්නම් වාලේ ගිහිල් හරියන්නේත් නැහැ, because අපරාධ වෙලාව ඔයගලන්ට වෙන වැඩක් තියෙනවනේ කරන්න. And also know the existing services. Now let's say at NHSL, most of the time the preparedness plan is definitely there. Then we don't have to utilize or mobilize people for Peradeniya, because we have done enough and more of that. But if it happens in Badulla, we might have to go there. But we can't. First, we need to figure out if the roads are clear. Right? Otherwise, we might have to do a Zoom meeting or something and prepare those people there. So obviously during the floods time, we were not able to go. The people who were exposed before in Colombo was not able to go to Badula. So we had to Zoom train them there. And there are 3 time periods: immediate period, intermediate period, recovery period. So පළවෙනි දවසේ දෙවෙනි දවසේ ගිහිලා නිකන් අතෑරලා දාලා හරියන්නේ නැහැ. They are just hanging there එතකොට. So immediate period එකේ psychological first aid, decide on who to give it, decide on where to give it, decide on when to give it, who are the agencies that we need to collaborate it with, whether it's hospital based or community based. Then in the intermediate stage, if it was initially hospital based, we might have to go to community based. So when we were doing the Easter Sundays, so when the second stage came in, some of those areas, usually I'm not being biased or anything, but තනියම female කෙනෙකුට සමහර දිහාවල වලට යන්න බෑ. And then you need to sort of get the proper people. Now in the floods, during the floods, the whole community was helping us. But during the Easter Sunday attacks, because people are kind of resistant to psychological services, we sort of used the priest. They first approached them and then they went and explained things to them. Then we went. So, and there was a whole load of coordination done by the Catholic Church, which made our lives very much easier. And they know their parishes now. So they knew මේගොල්ලෝ දැන් නැහැ මේගොල්ලෝ නැහැ. Some they knew to the extent that එදා මාසෙක මේගොල්ලෝ හිටියා. So these people might have been affected. They knew up to that extent. But on the other hand, you have to be sensitive to the fact there were the odd families who thought, we believe the God so much, but our kid was taken away from us. Some people made up their mind because it's the lovely ones who are taken to the God first කියලා ඒ පැත්තක් තියෙනවානේ. There were the other people who thought, how do we believe in God when we got attacked right in front of God? So while using all these resources, you have to be mindful, because this is a time where people lose faith on religion, on human beings, and so on, because man-made disasters cause more psychological trauma than natural disasters, because we know weather is not under our control unless that person has schizophrenia. But man-made disasters, that is different. So then intermediate stage, chronic mental illnesses, they tend to relapse, they don't have the medications, all these things. Now during COVID time, we had to post the medications. And during the COVID, our target group was who? Doctors, PHIs. ඒගොල්ලන්ට ගහන්න ගිහිල්ලා ඒගොල්ලන්ගේ ගෙවල් ළඟ ඉන්න neighborsලා ඒගොල්ලන්ව නිකන් separate out කරලා ඔය වගේ. And they didn't have means of going back to home because there were no buses. And female doctors, their kids were somewhere else. තාත්තා එක තැනක, අම්මා එක තැනක, ළමයි දෙන්න ආච්චිලා ගාව තවත් දිහාවක. And they were trapped. So, and so-called people who are there to help other people were affected there more than the lay people. The frontline workers were affected most, because they were getting exposed every day. And you have to wear that stupid PPE, like, and like being inside is also like terrorizing. And you have to safeguard your own life. And sometimes you can't go inside your house. So those are the people who needed psychological first aid there during the COVID time. That was another scenario. So recovery stage after disaster, yes, you can chip in, but then recovery stage is mostly for the people who are with long-lasting psychological illnesses. So by that time, you should have handed over your care of complicated cases to the psychiatry team. right? Because you are there to prepare, look, listen. Those are the things that they are there. And I taught you what you need to do. You can't go beyond that. Even if you're a doctor, if you're part of the PFA team, it's better not to undertake that, because you don't have you might not have the necessary equipment or the facilities, right? So what to do and what not to do? Psychological first aid, yes, you can do. Not to do is briefing. I have put media in both ways, because yes, they can say අර පැත්තට යන්න එපා, ඒ පැත්ත flooding කියලා, it can be protective also. On the other hand, they create havoc, right? And they give misinformation. And the more you get exposed to a number of bodies killed and all that, the more traumatized you're going to be. That's why I have put media on both sides. Right. Thank you. You have any questions? If you're feeling exhausted, you have to be able to say, I'm tired, I can't do this. That's also being assertive. Because in work like this, you are going to get exhausted. Just the fact that you have to walk miles and miles, I mean, whatever said and done, ඕගොල්ලෝ දර කඩන්න අර ගොඩාක් දුර ගියපු කට්ටිය නෙමෙයිනේ. ඒ ෆිසික් එක නැති වෙනවනේ, තිබ්බත් මෙතෙන්ට ආවයින් පස්සේ in the faculty මෙතනින් අතෙන්ට අතනින් මෙතෙන්ට විතරයිනේ. Because you all have to be physically and mentally well. උදේට කාලය යන්න ඕන. කොහොමත් කලන්තේ දාලා වැටෙන එක ආයෙ එතන කාලා නැතුව කලන්තේ දාලා වැටෙන්නත් බෑ. Because offensive smells, those are like, and altar towers, it's like when you look like this, you could see like, where they fell and everything, and you're like, ooh. And that's the ඒකේ balcony එකේ, that place, like, එතන CCTV නෑ, so we had to go there. And මෙච්චර විතර තාප්ප කෑල්ලක් තියෙන ඒකේ විත් එක. ඉතින් ඒකේ ගිහිල්ලා මිනිස්සුන්ට හිට ගන්න බෑ, නිකන් කකුලක් මෙහෙම වුණා ඩොංගාල වැටෙනවා. So just going there, we being human beings, we were like, how could you keep your feet or your back on this small thing? එතන උඩ වාඩි වෙලා හිටියාලු. I mean, it could be just accidentally වැටෙන්නත් පුළුවන්. ඒ එච්චරට කෙට්ටුයි. I mean, very narrow. So that's how it is. So the whole team needed to be like, helped. එදා ගෙදර ආවහම. So, but then, and also just because you're there, you can't be, if they say like, no, මෙතනින් එහාට යන්න බෑ, you have to accept that, because your safety and not violating laws, rules, that is also prime. අතන මනුස්සෙක් ගිලෙනවා වෙන්න පුළුවන්, but you can't do anything. මෙයාගේ ඩිස්ට්‍රෙස් එක නැති කරන්න කියලා මෙතන අම්මා ඉන්නවා, අතන බබා ඉන්නවා කියලා මේ අම්මා අඬනවා කියලා සයිකොලොජිකල් ඒඩ් කරන්න ලින්ක් අප් කරන්න කියලා අරයව ගිහිල්ලා බේරන්න යන්න බෑ. So you need to know the limitations, because I know people, because this අර heroic ඒවා කරන්න ගිහලා ඒකේ හොඳ පැත්තක් තියෙනවා, අනිත් පැත්තට you might die. So PFA වල ඒවා encourage කරන්නෙම නැහැ. Okay? No questions, right? So it sounds posh, PFA, but when you do it in different settings, it's exhausting. Because you're dealing with so many people, and house to house, door to door. And then if you go to a camp or something, so many people and so many needs. පොඩි එක්කෙනෙක් දැක්කොත් ඉන් toy එක ඉල්ලන්නේ. ගෑනු අයට සමහර වෙලාවට sanitary pads ඉල්ලන්නේ. So it's like, because psychological first aid is that if a person is having menstruation, providing sanitary pads. That's why, on the other hand, the good thing is it could be provided by anybody who is trained and who knows the limitations. Thanks.
Thank you, madam, for that introduction. Now I think we have a rough idea of what psychological first aid is, the scope of it, when we need to provide it, what we can do and what not to do as well. So we'll move on to the next segment of this workshop, the more interactive segment, right? We have prepared some clips from movies and TV shows that you all may have seen that depict people in these sort of stressful situations. So we have a QR code for you all to sorry about that. We have a QR code for you all to scan. It's a link to a Mentimeter. So we'll be playing the clips for you all one by one, and with that there'll be a question. So once you've seen the clip, you can answer the question on the Mentimeter presentation as well. And also we'll be passing around a mic, and we'd like to have more of a discussion. Madam will be here to facilitate it for us. All right. I hope everyone is. Seems like a couple more people are to join. So if you couldn't scan the QR, you can do it now also, or you can use the link here. Yeah. But it seems like everyone has joined, so we'll look at the first clip that we have. So the first clip we've prepared is from the film Hotel Rwanda. It's about the Rwandan genocide, and this particular scene, it's about refugees who have been displaced following the civil war, and we'll have a look at it and see.
Please. Yes, wait, it's going to be just a minute now. Please, Karin.
Tumukiza Yesu, akanafata neza, akanafata neza, akanafata neza, maze nishimo, nishimo, tumukiza Yesu.
Yes, so in that clip you see there's a refugee camp, and in the film the camps are full and there's not enough people there, so they are brought to this hotel owner tries to take it upon himself to locate him, and you see a mother being united with their child. So in this case of like displaced individuals, what do you think, what forms of support can we offer, and is there any psychological first aid we can do? We'd like to hear your thoughts. There is a mic to be passed around. If you'd like to raise your hands and answer, that'd be
Yeah, okay. So, in relevance to the clip that I saw, I can see like a group of children who are can you hear me? Yeah. Okay. So a group of children and also probably families that have gotten separated from the group of children. So if I were to say what forms of support that we can provide for the displaced individuals could be, first of all, now right now I think it's like acute after something that has happened, so maybe we can provide with proper shelter, food and any first aids that they might need at the moment, and then later on if they had like lost any, I don't know what exactly the situation was, but if they had possibly lost any family members, maybe any psychological support in relation to that. That's what I could come up with now, because I'm not really sure of what exactly happened. So.
Yeah, so there's some interesting prompts here: uniting with the family, physical needs and food, um, making the camp more habitable, psychological supports, basic needs, food and shelter. So I think that seems to be a common theme, that the meeting the physical needs is also a part of that. But if you were in the field, what do you think we could do, like as there is a situation like this? Madam, any thoughts?
And here, like, you have to keep in mind in the scenario, the shelter and food is most of the time done, it looks like. So that's why it's very, very important for you all to do the groundwork as to what is there available there and not available. දැන් මෙතන කෑම බෙදන වෙලාවේ තම බාල්දි ගණන් ගෙනිච්චයි කියලා වැඩක් නෑනේ. ඒවා ටික ඔක්කොම විසික් කරන්න වෙන්නේ. And there is a lot of wastage also happening. Yes, providing food shelter is PFA, but not wastage of food, right? And see the linking up, that is very, very important. Yes, but I think now it's going to give false hope to the whole load of kids who are there, because the age that they are in, they are going to come into the belief that this, just like him, we might find our parents as well කියලා. So, but then you can't prevent everything, you can't safeguard everything, but in that sense, that CJM office thing is better. ඔය බබාලගේ ෆොටෝස් ටික අරගෙන තියලා ෆොටෝස් ටික ප්ලේ කරලා ඊට පස්සේ අම්මට ඒක පෙන්නලා ඒ බබාව මේව කරනනම් අනිත් ළමයිට තියෙන ට්‍රෝමා ටික නැති වෙනවා එතකොට. So like, but then you need to be traumatized, like CJM office එකේ අර ඔක්කොමලා traumatized වුණානේ, but in a way there is sort of triad system there. And it has to be age appropriate. Okay, now මේ වයසේ කට්ටියට ගිහිල්ලා how are you මොකද උනේ කියලා අහලා වැඩක් නැහැනේ. You might have to give some toys and, like, you know, and they might have to be given hugs. So you have to, like, tailor made it to the age as well.
Also, I think earlier Madam mentioned that we should prioritize whom we give the care to. So I'd like to hear your thoughts. Yeah, in a refugee camp like this, whom do you all think we should be looking at particularly? What can we do in that sort of situation?
I think we should provide some motivation to these kids to make them feel that even though now they are separated from their families, like majority have lost their parents, lost their loved ones, but even though the situation is like that, we have to strengthen up their minds to unite them together and to stay as one, like to stay as one. So I hope, like, it will build up courage in these small children, so like they will have a feeling like they can move together. And actually this is a part, even though this is a part of a film, there are also real examples in the world, like even people who were grown up in orphanages, And then after a very long time, like they became world legends like Boris Spassky, then Luka Modric.
Yeah. So in that moment, maybe addressing the main need, which is like uniting with their parents. If there's anything we can do, speaking to the children and linking them with the proper support systems that can get them.
But you can't give false hopes.
Madam, what do you think about withholding information in that sense? Maybe telling the child that the parents are dead is maybe not the
Yeah,
best
you
thing.
have to be use your common senses there. For a kid like this, the trauma might be more if we say that the mom is never going to come back. At the same time, without knowing mom is going to come back, meantime, we could link up and trying to find a relative.
Madam, before we move on, would you like to add any final comments to the?
No, I
All
think
right.
we discussed
Sure.
basically.
Sure. So the next clip is from the film The Perks of Being a Wallflower. So there's this boy Charlie who has witnessed his best friend commit suicide, and because of that, he has been hospitalized as well for depression. And at this point in this movie, he is facing a lot of trouble from school and whatnot. And he is also contemplating maybe harming himself or taking his own life. So let's just have a little bit a look at that scene.
It'll be our little secret.
Candace, your brother's on the phone.
So the question we have is, what is an appropriate way to ask about suicidal thoughts in a supportive manner? So in this case, Charlie is someone we probably identified could be at risk of having these thoughts because his best friend has also passed. What do you all think? How is an appropriate way to ask somebody in this psychological first aid setting? What's wrong with you? That's a bit.
Yeah, so in many cases, like suicide and these stuff are considered as like a taboo way. So it's considered taboo. So people think that it's bad, and like someone who like the suicide and stuff, they're like covered. So maybe like explain to the person first that this is usual, this is normal, that what you're feeling is pretty common in every individual, and let them feel that it's common and it's not bad to talk about it and it's not bad to feel like that. So in that way, they'll be more open about their feelings.
Madam, anything to add to that?
So now when it comes to post-traumatic stress disorder, we say the definition is like, you're exposed to a extraordinary stress. So you've developed post-traumatic stress disorder, and earlier it could be something like man-made or natural disaster like a flood or bomb or getting raped. Those can lead to post-traumatic stress disorder. Now the current thinking is depending on the personality and so on, what I mentioned earlier. නිකම් මාස් තැනක කාව හරි ලොකු තැනක කාව හරි පික් කරලා යාව මොනවා හරි humiliate කරා නම් that is enough to cause PTSD. So just like that, watching a movie like this also can cause PTSD. ඕක මතක් වෙවි සමහර වෙලට PTSD වෙන්නත් පුළුවන්. So you need to be very much aware, like, about your emotional status, whether you're a person who get very disturbed by these things. එහෙමනම් PF එක කරන්න යන්න ඉස්සෙල්ලා චුට්ටක් හිතන්න ඕන. Or for that matter, psychiatry කරන්න ඉස්සෙල්ලා. Or for that matter, surgery කරන්න ඉස්සෙල්ලා. Just because I saw this, like, that's why I was like telling this. Now, even people who were doing psychiatry, senior registrars, they couldn't tolerate seeing those Lotus Tower and those things when we were doing the psychological autopsy. That's one thing. So be careful. And this scenario is also a place that you should recognize as where PFA is not applicable. This is this kid directly to a psychiatry team, not your business. Because there are things that you should do and you shouldn't do. No? But this is, yes, after floods and things, people can get like they have suicidal ideas. They can say, මට මැරෙන්න හිතනවා දැන් නම් ජීවත් වෙලා වැඩකුත් නැහැ. අවුරුදු ගණනාවක් මේවා කළා හම්බ කරපු ගේත් නැහැ. ඩඩඩ මැනික් මල්ලත් නැති වුණා. blah blah blah. Right? So, but here there were so many things. There were flashbacks. ලාරයා හිටගෙන ඉන්නකොට යාට මතක් වෙනවානේ ඔක්කොම ඉස්සලා වෙච්ච. So this is PTSD, depression. So they are a tier එකේ උඩම specialized. You remember that pyramid? So that's top it. But so this is not for PFA. So that is to recognize what PFA is not all about. But on the other hand, then ඔගොල්ලෝ දන්නවා psychologically බලනකොට if they are worried, අඬනවා, එපා වෙලා දැන් නම් ජීවත් වෙලා වැඩක් නැහැ කියනකොට next thing is you have to ask about suicidal ideas, right? දැන් ඔගොල්ලෝ ඇවිල්ලා දැන් final year එකේ mockies කරනකොට වගේ final years ලා නෑනේ මෙතන. What you guys do is දුක හිතනවාද? ඔව්. මරන්න හිතනවාද? ඔව්. ඔහොම ඉතින් නිකන් අර ඇමරිකාව මිසයිල් ලෙවනවා වගේ මැරෙන්න හිතනවාද කියලා what people won't say yes. Okay, that's number one. And some of you ask, මැරෙන්න හිතෙන්නේ නෑනේ. If I ask you, මැරෙන්න හිතෙන්නේ නෑනේ, what else can you say rather than no? So that's a very close-ended question. එහෙම බෑහන්. So then මෙතන දුකයි, ඊට පස්සේ දැන් ගේ නැති වුණා, ඔයාගේ ඔක්කොම මේ ජීවිත කාලෙම හම්බ වෙච්ච. ඉතින් සමහර වෙලාවට මිනිසුන්ට ඒ වෙලාවට මැරුණා නම් හොඳයි, දැන් ජීවත් වෙලා වැඩක් නැහැ කියලාත් හිතෙන්න පුළුවන්. ඔයාටත් එහෙම හිතිච්ච වෙලාවල් තියෙනවද? So then they would think මේ මනුස්සයට තේරෙනවා where I am කියලා they might tell you. That's why same patient asked by two medical students, one pass and one fail, because the same patient has given two answers. What else to say? Right? So the way you ask is very important, and also there is nothing which says you can't ask about suicidal ideas. A person who's having suicidal ideas, if somebody asks, that's a relief. Most of the time they would say yes. They would open up to you.
And I think, Madam, here in the responses, we can see a lot of them are about just starting a simple conversation with them. Maybe there's a link to the thing you said about not debriefing, not asking about their trauma. It's more better to maybe approach more friendly and get an idea.
But ඊට පස්සේ මොකද උනේ? ඊට පස්සේ දැන් මොකද හිතෙන්නේ? හා you know, අර gossip mode එකට වැටෙන්න එපා.
Right. Okay, I think we have an understanding there. There are definitely some cases which are not PFA as well. So we have to identify those patients and direct them for better support. So here's the next scenario as well. I'll just give you all an introduction, and we'll think about this question. And while we're watching the clip also, we'll think what might indicate that the person is overwhelmed emotionally. But also linking back to the previous one, I want you all to think, is this a place where PFA is actually applicable or not? So I'd like to hear your thoughts. So this is from a film called Little Miss Sunshine. In this, there's this main character boy, Dylan, who wants to be a fighter jet pilot. And he's just finding out his father is telling that he's colorblind, and that means he won't be a pilot. His lifelong dream is absolutely shattered. So this is the scene that we're about to see. And how does he react to it?
Dwayne, I think you might be colorblind.
fly jets if you're colorblind.
Maybe they might have, violent outbursts. Maybe they'll start shaking and maybe they're paling up. Or like two scenarios, either they'll start screaming or crying or something, or they could do the opposite. Maybe they might shut down their emotions, just, hide their emotions and just stay still. Like it could go either way because people have different emotional responses. Either they go have a complete meltdown or they have a complete shutdown.
Yeah, so like when we are at a disaster site, say following a flood, we're at a relief camp, we might see all sorts of people, and we have to prioritize whom gets the psychological first aid. And we might want to be able to identify who are the people who are particularly overwhelmed and need the attention first. So if we do identify somebody, what do you all think should be done? Like based on what we just discussed earlier, we've identified somebody, then from then on, what's the, what are we supposed to do? What do you all think? Anyone can raise a hand.
Not a direct answer to Ravinshu's question, but rather something that I would not do is break the news to. I'm talking about the scenario where the news hasn't been broken to the person in question yet, and I would ideally not do it the same way that this father or relative, mentioned it. He was so like, I don't know, nonchalant about it. He was just like, "Oh, you're colorblind. You can't. Your entire, life's aspiration has just gone down the drain." And he doesn't seem to like give enough weightage to that fact. Or that's what I'm telling. So he could have gone about it. Sorry. Okay, all right. Sorry. So more rather, I just wanted to focus on what you should not do there again. And as to how you should be breaking it to him, probably in some sort of space where he would have the time and the space to process that, and maybe not in front of like all of his other relatives who seem to be in that vehicle with him. And yeah, I think that's just what I wanted to add to it. Not really a direct answer to Ravinshu's question, but more rather how differently they could have like gone about it. Yes.
Yeah, thank you, Thor. Madam, any thoughts on that? Yeah.
So when it comes to breaking bad news anywhere, let it be like, or in a camp where like, come tell your mother is dead. එහෙම කියන්නේ නැහැ. Right? So that's why you are being taught how to break bad news. The spikes model, you have to look for the spikes. S is for setting, P is for perception, I is for invitation, K is for knowledge, E is for empathy, S is for summary and strategy, right? So spikes model needs to be used. This is not the way caravan, right? Okay. And then, so setting is very important. Then what does he know about it? What does this person already know? So you need to know that. And whether he wants to know at this particular time. සමහර කට්ටියට මට දැන් අහන්න නැහැ. So then you have to respect that person, right? So all these things should be need to know. So so that's breaking bad news. So that's why preparedness is very important. Community preparedness, like all of you all need to know how to prepare for something. When it comes to emotional overwhelmingness, anything that is not appropriate for that situation or for that person this. Like let's say කවුරු හරි මැරිලා අඬන්න ඕන තැන කියනවා නම් නෑ මම මැරිලා නෑ මගේ තාත්තා තාම ඉන්නවා මොන පිස්සුද. That's abnormal. That shows that the person is emotionally overwhelmed. So if it is going to last for some time, that's beyond PFA. You need to refer for psychiatric stage help. හැබැයි කවුරු හරි තාත්තා මැරිලා මෙතන පෙරලි පෙරලි අඬනවා නම් yes that person is emotionally overwhelmed, but that's fine. Let that person cry. දැන් මහත්තයා මැරුණාම නෝනාට කියනවා අම්බෝ අඬන්න එපා ළමයි ඉස්සරහා. නෝ ළමයිනුත් දැනගන්න ඕන අම්මත් දැනගන්න ඕන එනවට කමක් නැහැ. Because prolonged grief, inhibited grief, those are the bad things. So that's why I said inappropriate to the person and inappropriate to the setting is emotional overwhelming. So කතා කරන මිනිස්සේ all of a sudden කතා කරන්න නැතුව නිකන් ගාගෙන ඉන්නවා නම් mute වෙලා, that is also abnormal. So you try talk to that person මොකද වෙලා තියෙන්නේ මොකද උනේ කියලා අහලා ඒ වැඩේ හරියන්නේ නැත්නම් ඊට පස්සේ that means it's beyond you. That's not PFA then.
Madam, this particular clip, what do you think? He was like non-verbal, but he was also, that's, you expect that reaction, right? When you have your...
තාත්තට ටොක්කක් අයින්න ඕන. Typical Sri Lankan father කෙනෙක්.
So in this sort of a setting, we would say no need PFA yet, but just wait, see if it persists for some time.
Yeah, there is a place for PFA. Now you calm down. We don't know what the alternatives are, and I'm just saying that there might be a problem with this thing, and so let's get it checked. Let's use Ishihara's charts or whatever, and ඒක කියන්න ඕනේ that was a joke, okay, very much developed, and there might be means and ways of overcoming that. So, and I'm also not sure, I'm not a doctor, so that's how you would come about. So that's the PFA part. But තවත් ගහන්න යනවා නම් ඔයගලන්ටත් ගුටි කන්න වෙනවා නම් that's not PFA.
Okay, thank you for that, madam. So we'll move on to the next scenario. So this is again another clip we'll show you. It's from a movie called Enough, where this woman and her child, who were being abused and poisoned by their husband, is being rescued. So let's just have a look at that clip.
No, help me. I gotta get her out of here.
Okay, enough with her. Get out. Get out. Wake up, baby. Look at Papa, baby. Wake up. Wake up. Look at your Papa. Yeah, wake up. We're gonna go for this little ride. Look at your Papa. I'll help him up. Get the bag. Look at Papa. Look at Papa, huh? I'll see you soon. Bye, sweetie.
And he's tied up because once I got her tied up.
Could be a broken rib.
So yeah, the question is, what type of support could a person, like what sort of how can you get them to talk? Someone who has just been experienced domestic violence. So while we answer that, we'll pass the mic around as well. One thing I noticed was there was not just the mother, but there's also a child there involved, and she might also need PFA, and not just the child, then the rescuers, they were also held at gunpoint just then. So there might be many layers to this. So how could you get somebody to feel safe to talk? What kind of PFA might we be able to provide? Yeah.
Thank you. So actually, I also experienced a similar situation like that in the surgery ward, because I also got a patient who has a female patient who has undergone serious domestic violence. And the thing I asked is, after getting a history, I asked her, actually, Amma, did you think like you want to end your life or something like that? And she said, actually, yes, I felt like that. And actually, I even tried to suicide. Actually, my children saved me from that, and this and that. I think then actually, I think madam can also remember I called madam actually at that time, because to tell like actually she was also needing help of a psychiatrist, and the thing is like she didn't have any like she was not financially strong to go for private health care. So I told them like madam is in ward 59, like if you want madam can help you if you like feel like anything suicidal. And I also told her like any moment if you are feeling suicidal, please call this number 1926, then you will be delivered to the National Institute of Mental Health, and they will call you and they can assess your situation. Then they will be able to help you. So I personally think that, and in such a situation like that, like we should assess like what's the degree of suicide the patient is in, whether he actually wants to harm himself, or does he have a he or she have a feeling of like have any hope of living.
Yeah, so thank you. So I think a lot of the answers also like tell them that the conversation go beyond the room, make them feel safe. And then like I said, like once you have done the initial assessment of once you've done the assessment that it's something beyond your scope, then maybe linking it, that's also part of the PFAs to link it to a different point. Any ideas on the child or what we can do in that case?
This is Sri Lanka, so we don't have services like this. ගෙදරට ගෙනල්ලා 911 ගැහුවයි කියලා ඇවිල්ලා ළමයාවයි අම්මවයි බේරගෙන යන්න ටීම්ස් ලංකාවේ නැත. Whereas how they would present to us is එක්කෝ ළමයාට ගහලා ළමයාගේ අඬක් කැඩුනහම රිබ් එකක් නෙවුණා. දැන් අර that's a broken rib කියලා කිව්වේ, that must be a broken. ඒක ඉතින් ළමයා හෝ අම්මා තමයි හොස්පිටාලට එන්නේ. එතකොට තමයි that we would get it. So the mother can call hari මෙහෙම ගහනවා කියලා. ඒ උනාට ඉතින් හරි because අපේ කට්ටියට ඉතින් the services are limited නේ. or අර විදිහට එනවා. The thing is, the scenario is that because those support services are not available in Sri Lanka, non-working woman to get out of that situation needs a lot of effort. ළමයිට කන්න දෙන්නේ කොහොමද? එයා කන්නේ බොන්නේ කොහොමද? ගෙදරින් පැනලා ඇවිල්ලා නම් දැන් ඉන්නේ අර පවුලෙන් cut off කළා නම්, for some reason that is a scenario sometimes. And then this woman and the child has nowhere to go. Of course, women in need is there and there are few places, but those places are always full. ඊට පස්සේ අපි ඔක්කොම කළා ජේමෝ රෙෆරල් ඔක්කොම කරායින් පස්සේ නෑ මම මෙයාත් එක්කම සමාදාන වෙලා යන්නම් කියනවා. I think the whole thing is like a flop. අම්මට පොලිසියට ගිහිල්ලා කියන්න පුළුවන්. And Sri Lanka has a very good domestic violence act which is PFA, right? එතන ඉන්න පොලිස් නිලධාරියට ඉතින් උගන්නලා තියන්න ඕන සමාදාන කරන්න නැතුව ගෙදර යවන්න එපා. සමාදාන කළා ගෙදර යවන්න. අනේ දික්කසාද වෙන එක හොඳ නෑනේ අම්මා. ගිහිල්ලා සන්තෝෂෙන් චුට්ටක් ඉවසගෙන ඉන්න. That's what happens in Sri Lanka. I mean, another psychological autopsy I did of a maternal suicide in the postpartum period. So just for because the man sounded a bit fishy, we went to this particular Colombo area police station to see there were about 3-4 police complaints made by that woman due to domestic violence. හැම සැරේකම සමාදාන කළා ගෙදර යවලා. It's not only that the legal system has not helped, just imagine the male state of mind. සමාදාන කළා ගෙදර යවනකොට පොලිසියට ගිහ උදව් ගන්නනේ ඔය හම්බුණානේ උදව්. දැන් ගෙදර ආවයින් පස්සේ it's going to get worse. So yes, linking up all these things is PFA, but you have to do it properly.
So, madam, in the ward, if we have a patient who comes with a broken rib, and you talk a bit, and you figure out, okay, they're a victim of domestic violence. So then, from there on, if the police also, that system isn't there.
Because now, because that's the typical scenario, but it doesn't happen everywhere. And particularly, then we link up with the existing families, and then අපි ගොඩක් වෙලාවට ඒගොල්ලන්ට බාර දෙන්න police වලින් උනත් ඊළඟ සැරේ නම් බේරන්නේ නැහැ කියලා පොඩි warning එකක් දීලා යවුවනම් then that domestic violence is not going to get worse. Because අතන female එක්කෙනාව empower වෙනවට වඩා male එක්කෙනාව empower වෙලා ගෙදර යවන්නේ. පොලිසියත් මොකුත් කරන්නේ නැහැනේ කියලා, right? So you have to do your job right එතන linking up එක support එක, and there is a lot of room for support, linking up, expressing the emotions and gathering up information, all these things. කියන්න පුළුවන් දැන් මේ ළමයාට අම්මා කෙනෙකුත් නැහැ තාත්තා කෙනෙකුත් නැහැ වෙනවා නේද මේ domestic violence එකෙන් ඔයා මැරුණොත් එහෙම කියන එක. And සමහර කට්ටිය ඊගෝ එක හින්දා තමයි අර දැන් පැනලා ආපු හින්දා ආය අම්මට තාත්තට link up කරනවට කැමති නැත්තේ. So you could get them down, and and most of these females are like Kavindu said, are depressed. So depression එක හොඳ කරාමත් they get that empowerment to නෑ මීට පස්සේ මං ගෙදර යන්නේ නෑ කියන එකට. So, and then also perhaps getting down the husband. If it is due to morbid jealousy and alcohol dependence, treating the husband might solve the problem. So, gathering information as in PFA. So, those are the important things there.
Madam, one thing, so in terms of following up, with PFA, is that included, or do we cut off at some point?
Because
right?
you have to cut off, because if it is morbid jealousy and alcohol dependence, then you have to give over the care to the psychiatric team. So PFA is you have to take it along with physical first aid. After hospital එකට ගෙනියනකන් you give a support, but ඊට පස්සේ POP එක manage කරන එක ඕගොල්ලන්ගේ job එක නෙමෙයිනේ. Like that. So you need to know where to draw the line there.
Okay, thank you, madam. So we'll move on to the next clip. We have two more. Yes. So this next clip, it's from this TV show called Chicago Med, where this doctor has to actually break the news to a small boy that he might have the same type of cancer that his elder brother has. So it's, like I said, breaking news, but also to a younger patient. And we'll just have a look at the clip.
Again, I'm so sorry.
So the parents have been told about it, and now she has to tell the child. So we didn't get to the part where she tells it, but if it were you, for that child, what sort of emotional support do you think would be needed? And we'll add to that, what about the parents? Because they've already been told the news. So mentioning that maybe the parents should be informed first of it, of course. And then another response, find out the level of awareness of the child and their concept of death, and based on that, talk to them. Yeah. So this child may not have a complete understanding of what's going to happen. So again, what level of PFA do we do, and how do we apply that?
So in that particular scenario with the child, maybe like, it depends. First, I think we have to ask the parents how much the child knows about death and loss and all that potentially. If the child does not have a concrete idea of death, maybe you could phrase it in such a way like, your brother or your sister's gone somewhere with God or something. If they are religious, we could say he's with the stars, he's with the clouds. Don't need to mention that, oh yeah, he's gone forever. We could say he's in a better place. But if the child has a concrete idea of death, or if it's atheist or something, I think we should mention it quite sensitively. Maybe mention that the brother still loves them, or simple things like that. But I think it's much easier if it's a religious child, because then you can mention how he's with God, with all the angels in heaven, So the child might feel, not so sad, because, at least there are siblings out there looking over them.
Probably, yes, you could incorporate the sort of religious thing, but also I think important not to be judgmental of people and their views when you approach that. So, madam, any thoughts on that?
Again, it's Spike's model setting. If when the child is over there sitting along with some kids, you can't do it, right? And then perception, So, what do you think? Why do you think you're in the hospital? That's the question. Perception is like what that kid knows and thinks. So then when you know the perception, then you know whether this child has the concept of death, whether this child is knows what happened to the elder brother, and whether he would be okay to be with him if the elder brother is in heaven, because you need to sort of tailor made it to that person's developmental age. So that's what we need to know. So from there onward, sometimes if the death concept is not known, then you don't have to tell anything. And of course, because this child is a child, you need to have a chat with the parents first. And if the child says, I don't want to know, you can't say. And if the parents say no, better not tell him, let's take it as it comes, we might have to honor that decision also, because it's a kid.
Thank you, madam. Any other thoughts that you would like to share? So overall, the idea seems to be that for a child, it's much more different, and the complete understanding is not there. So you have to be sensitive, and sometimes, like we discussed earlier, that sort of debrief of you're going to die would probably do a lot more harm than good in the case of the child. Yeah, much more important if they understand, to link them and to calm them down, settle them down. But if not, maybe that's not what we should pursue. Right. So in the interest of time, I think we'll be wrapping up today's session. I hope that you all learned something today about PFA. There is a feedback form for you all to fill. That's not. Sorry, in the Mentimeter. Yes, so you can use this Mentimeter slide as a feedback form. So I hope the discussion was useful for everybody. I think now we have an understanding of the core concepts of psychological first aid, as also when and when not to, more importantly, when not to apply those concepts, and how we can maybe incorporate this even into our day-to-day, not necessarily, disaster situations, but even in our day-to-day lives, we may come across situations where a little bit PFA is needed. So as we draw the workshop to a close, I'd first like to invite Madam to receive a small token of our appreciation. Thank you, Madam, for your expertise and the help with guiding today's discussion. And yes, with that, we have come to the end of the informative portion of today's workshop. And yeah, before we wrap up, I would like to invite Mahisha, one of the co-chairs of the project, to deliver the vote of thanks.
Good evening, everyone. So, it's my great pleasure to deliver the vote of thanks on behalf of today's psychological first aid training program. First and foremost, I would like to express my sincere gratitude to our Dean, Vidyajyoti Vajiraj W. Disanayaka, for his continuous support and guidance. My heartfelt thanks goes to our guest speaker, Prof. Chajura Suravira, for sharing her valuable knowledge and experience. Your insights have truly enriched our understanding and inspired us all, madam. I would also like to extend my appreciation to our senior treasurer, Prof. Priyanka Ranasinghe, and the executive committee of the CGDR for their support and coordination throughout this program. A special mention goes to our president, Ashwini Chandrakumar, secretary Amiru Somanayaka, and treasurer Oshada Fonseca for their leadership and dedication in organizing this program successfully. I would like to convey our sincere gratitude to our Vice President Pamuda Pereira for guiding us from the very beginning of this project and for his continuous encouragement. I would like to thanks to our compeer Ravishu, and I would also like to thank Rohit Randev for helping us with the photography. I would also like to thank Mudit, Vijirajan, and Abhishek for their efforts in post designing and video preparation, which added great value for this program. We are grateful to the technical staff, hall management team for ensuring that everything ran smoothly. My appreciation also goes to the co-chair of this project, Sadhini Mihanga, for her support and commitment. Finally, I would like to thank all participants for your active involvement and enthusiasm. Your presence made this program meaningful and successful. With that, I conclude the vote of thanks and thank you.
Thank you, everyone. With that, we've reached the end of today's program. Before we head off, I'd like to invite everyone to the front just for a quick group photograph. Yes.
Guys, please make your way right to the center. We will take a quick group photo and then Oh, this way. Ah, okay. Apparently this way. So everybody come onto this side. Just position yourselves there and then we'll take a picture. Can we have maybe 2 rows? Maybe a row like kneeling in front, whatever, because everybody won't be able to be captured. If there's a row that's willing to go down, yeah. Yeah. I will come and sit down. Because y'all will not be seen if y'all can come a bit onto this side. Yeah, yeah. Madam, you. I will come back. Awesome. Just make sure y'all are seen. Okay. Yeah, yeah. Can you? Yes.